If you've clicked on this video, it's likely that you or someone that you know has had multiple IVF cycle failures. First of all, I'm sorry that you've had to go through that, but you are the very reason why I do what I do right here on Hey Doc. If you've had multiple IVF cycle failures or you know someone who's had multiple IVF cycle failures, this video is for you. So keep watching. Hello everyone, welcome back to Hey Doc. For those of you who are new on this channel, welcome. Here we discuss everything to do with fertility medicine. We leave no stones unturned. We also address women's health matters and pregnancy related issues. So if that sort of thing tickles your fancy, be sure to subscribe, share the content, and be sure to like. Okay, you've had multiple IVF cycle failures. What do you do after that? What should be your next line of action? Very often, if you speak to your fertility specialist, he or she may well be tempted to tell you to go straight for another cycle without sitting down and personalizing all the different options to make sure that you are making the right decision for you. And that's exactly what I intend to do in this video. So here we are. Before I go into the details of this video, I just want you to be aware that I have done two separate videos about the different causes of IVF cycle failures. The first video was looking at the common causes of IVF cycle failures, and the second video was a little bit more in depth, looking at some of the rare causes of IVF cycle failures that some fertility specialists will overlook. And so if you're serious about your next IVF cycle being successful, you will go ahead and watch these two videos, of which I will leave a link in the description box. Okay, straight into today's matter. After an IVF cycle failure, not to talk of multiple IVF cycle failures, the first thing that you must do is to pause. That's right, you heard me correctly. Stop. Take time to reflect. Review everything, cycle by cycle, for those of you who have been unfortunate to have multiple cycle failures. I'm hoping that this video will reach out to more women who have gone through one IVF cycle failure, so that they don't have to go through this soul-crushing experience again without doing some of the things that I will talk about in this video. Need I say that IVF is physically, emotionally, and oftentimes spiritually draining. After one, not to talk of multiple cycle failures, it is absolutely okay to grieve. It's absolutely okay to shut the world out and take time to consider and reflect on what has happened. In fact, I would argue that at this stage, you are more important. Yes, you, the woman, is so important. Not to say that your husband is not also important and is also not grieving, but it is you who has gone through the physical demand of the injection of the medication, the retrieval of the egg, and having the embryo inserted. So you are the one that needs to be in a place where you are pampered and cared for. You need to be in a position where you have access to a fertility therapist. Join support groups online. Being careful, of course, not to join just any group. As a Christian doctor, I strongly advocate that you surround yourself with people who are going to speak the word of God into your life, who are going to be able to speak God's word and God's promises in the trying time that you are going through. So this grieving season is not a reason for you to just join any group that is labeled, fertility, grieving, or failed IVF cycle. Reaching out to women who may or may not know the Lord, I encourage you to join groups that will speak word of hope and proclaim the truth of God's word into your situation. So it does not necessarily have to be a fertility group, but it needs to be a group where you're getting encouragement, ideally from someone who has also gone through it and can offer word of wisdom and support. Practice stress reducing habits like going for a walk for 15 minutes every day. Prayer, of course, but God understands where you're at. When you are grieving to Him, you may not be able to pray as much. You may not even be able to read the Bible, but just being able to acknowledge His presence and ask the Lord to be your present help, to ask the Holy Spirit to be your Ebenezer, and just be able to rest. So if you took time off work because you were going for an embryo transfer, it may be that you might need a little bit more time off work also. And coming back to joining groups, listen, you don't have to do that. You might be a very private person and you don't necessarily want to talk about your experience with everyone. That's why I encourage you to have one person. If that is your husband, that's fine. That's the person that you will speak to, but you will need a shoulder to cry on, to release all of the emotions that you are feeling. And when you feel like giving up, it is okay to acknowledge that that's where you are at that present moment in time. And that other person, whether it's your husband or any other person, the one person that you've chosen to be able to support you where you're at and then help you later on at the time that is appropriate to help you rationalize the reasons why it might be worth you going for another cycle. Okay, that is the emotional, the grieving, the self-care aspect of having gone through an IVF cycle failure. Whether it's one, whether it's multiple cycle failure, those are the things that you need to do first. The ability to be in a place where you're resting, crying, and letting out all of the emotions whilst you're being adequately supported. That's that done with. Now you feel ready to go again. You are so determined to be a mother that you summon up the courage to be able to go for another round. What is the first thing that you should be doing when you are in that place? When you're in that place, ready to face the infertility challenge before you. Of course, you're going to want to speak to your doctor. You're going to have 101 questions. And in fact, that's when I will tell you, you will know whether that fertility specialist is the right doctor for you, or whether for your next cycle you should be considering moving on to a different fertility specialist. A good fertility specialist after an IVF cycle failure needs to be available for you, needs to make time to be able to sit with you, possibly even in the presence of a fertility therapist, to be able to discuss what went wrong, what went well, but what went wrong. What are some of the things that could be done differently next time? If your fertility specialist does not make him or herself available, please do not. And this is part of the things that you need to do after an IVF cycle failure. Do not go for that fertility specialist again. If he or she does not make themselves available for you during that trying time or during the time when you want to discuss what went wrong, that's the sign of a bad fertility specialist. And you will tend to be able to identify that. In fact, there'll be signs at the very beginning of the cycle. Those signs are you are forever speaking to the admin staff, to the receptionist. You are not able to speak to that doctor directly yourself. When you see that, you know that that doctor is going to be a poor communicator. And so naturally, once you've gone through a cycle failure, that doctor is going to be less likely to have the time to be able to sit down with you to discuss what went wrong. Those kind of doctors tend to be there to encourage you to go again, to offer you all of the gimmicks and the fertility tricks in order to make the next cycle more successful. They want to sell something to you as opposed to sitting down with you and considering all the different pathologies that I talked about in my previous 2 videos on IVF cycle failures. So that's a bad fertility specialist. Let's assume that your fertility specialist is amazing. He or she is happy to make out time to sit down with you to talk about what went wrong, what could be done differently, so on and so forth. You're going to want to sit down and write down all of your questions. Please, I really encourage you all ladies to go and watch my 2 videos on the reasons for IVF cycle failures, because when you watch those 2 videos, you will be able to come up with questions that you need to ask your fertility specialists. You need to be able to ask relevant and constructive questions. By the way, ladies, that review appointment with the fertility specialist is not the time to be emotional. This is a time to use time wisely. Not that the fertility specialist doesn't care, but you want to maximize that time in order to make your next cycle successful. So just in case you are struggling with some of the questions that you need to ask at that review appointment, here is a list for you. The first question you might want to ask is, was any pre-implantation genetic testing done on the embryo? And usually for this one, you will know if that was done. Your fertility specialist will have that frank discussion with you and say, look, it would be a good idea to test the genetic quality of the egg and possibly that of the sperm also. So you will know, because that usually comes at an extra fee. But nevertheless, if you did not hear about it, if nobody offered you the PGT, again, which is the pre-implantation genetic testing, if it was not offered to you, you have the right to ask, was it done? Why was I not offered this? And who knows, maybe it was done, but your fertility specialist forgot to mention it to you. So it's a worthwhile question to ask. Was there any issue with the embryo transfer technique? Was the timing of the embryo transfer personalized for you? And did you get tested? And did you get tested for immune or blood clotting disorders? Okay, let's break each of these questions down. But before we go on, I just wanted to remind you ladies that this initial appointment or the review with your fertility specialist is not a time to be apportioning blames or trying to pin the blame on the doctor or the lab. Think about it more from the point of view being a detective, because sometimes the missing piece is in the details. Before I continue with this video, have you subscribed? You know the deal on YouTube. Subscribing is free, liking is also free, and sharing is even more free. Make sure that you are not consuming this helpful content for yourself, but you are sharing so that a woman or a man or a couple going through anxiety, stress, and don't know what to do with their multiple IVF fail cycle can come across this helpful content in order to also help them in their journey and with their struggle with fertility. So thank you for subscribing. The first question that addresses the quality of the embryo and talks about the PGT testing. PGT, as mentioned, is a technique used during IVF, and it allows us to check for any genetic or chromosomal abnormalities within the embryo. Or it can also be used to determine the genetic material within the egg by itself and within the sperm cells by themselves before the egg and the sperm cells are brought together in the Petri dish in the lab. And what that does, it helps us to determine the embryos or the gametes, and that's the eggs or the sperm, that have good genetic material and that are more likely to implant within the endometrial lining. And because if the genetic material within the egg or the sperm cell or even the embryo is of poor quality, implantation is likely to fail. And even if implantation was to occur, that embryo has a higher risk of miscarriage. It is possible to check the genetic material within the egg and the sperm cells by themselves in isolation. Okay, that can be done separately before fertilization happens, and that's more relevant when the man or the woman wishes to freeze their gametes. So they wish to go for egg freeze or sperm freeze. So we test the genetic material of the retrieved eggs and we 10, and it is possible to decide to freeze only the eggs that are of good quality. And if it is found that most of the eggs that have been retrieved are of poor quality, that woman might decide to go for multiple rounds of ovarian stimulation in order to be able to have a greater pool of eggs that are of good quality before they are all frozen. Okay, so that's that. But as it relates to PGT, what you must know for your next IVF cycle is that it tends to be done after the egg is fertilized and the egg has multiplied, and after day 5 to day 6, once the mass of cell is now termed a blastocyst, and at this stage where the embryo is now a blastocyst, a few cells will be removed from that blastocyst and then taken for testing in the lab. Don't worry, this does not harm the embryo at all. In fact, the embryo can be frozen while testing is being done. The benefit of PGT is that only healthy and chromosomally normal embryos are selected. So your second question looks at the endometrial thickness and its receptivity. In order for implantation to happen effectively, the endometrial thickness has to be anywhere between 7 to 14 millimeters thick. If the lining is too thin, let's say 6 millimeters or less, implantation simply will not occur. The endometrial lining may be considered as not being thick enough for the attached embryo to be able to continue to grow and thrive. A thin lining will lack adequate blood flow, nutrient, and adequate structure for strong and good implantation to occur. Now, ladies, this is what is really important for you to know and be aware of, and make sure that this is actually done and observed for your next IVF cycle. Did you know that it is very possible for you to be able to work out when your endometrial lining is at its best for implantation to actually occur, or rather I will say for you to have an increased chance for implantation to occur? Yes, it is possible. And that is done by working out the endometrial receptivity analysis. It's actually a way of working out your own personal window of implantation. So essentially, ladies, what you must do for your next cycle is make sure that you sit down with your fertility specialist. Pay extra if you must, but make sure that that window of implantation is worked out for you, because that's going to be the best time for the embryo to be transferred. So now that you know this, for your next IVF cycle, do not turn up at any time, any random time that your fertility doctor will tell you, come and embryo transfer will happen. No, 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 no. You will be asking your fertility specialist, did you do the ERA? And did you work out my window of implantation? Why is that important? God forbid that this next cycle also fails. At least you know that you have ruled out anything that could have potentially be avoided. Yes, it's possible to avoid poor implantation because of a thin endometrial lining. Did you know that it is possible for your fertility specialist to work out if your endometrial lining is too thin? Yes, just by doing an ultrasound scan. So if your fertility specialist identifies that your endometrial lining is too thin, it will be a dreadful error. In fact, I will consider it as possibly even neglect, especially if your fertility specialist knows that you have suffered multiple IVF cycle failures. It will be horrific for him or her to allow transfer to happen when they know that your endometrial lining is thin. There are medications that they can give you to thicken up your endometrial lining. So once they've worked out your ERA and they know your window of implantation, i.e. when embryo transfer is best for you, that's the time that they need to be targeting. But I would say that your doctor would be considered an even better doctor if they were able to give you an ultrasound, double check your window of implantation by doing an ultrasound and making sure that your endometrial lining is indeed thick enough, that it is between that 7 to 14 millimeters before the embryo is transferred. So a very good doctor will work out your personalized window of implantation, but they will go one step further in doing an ultrasound before they transfer that embryo. It is your right to ask. You are able to ask. Yes, you've worked out my personalized window of implantation, but doctor, can you do an ultrasound before you transfer the next embryo? Why? Because if they think they've got your personalized window of implantation right, but they do the ultrasound and your endometrial lining is too thin, then you can be given the right medication to thicken your endometrial lining before the embryo is transferred. The next question actually looks at the embryo transfer technique. Did you know that there is a correct and wrong way of placing the embryo within the uterine cavity? Yes, there is. The embryo should ideally be inserted into the uterine cavity in the middle upper section of the uterine cavity, away from the cervix and away from the uterine walls. Incorrect positioning will lead to implantation failures. Full stop. If the embryo is placed too low, it can lead to an ectopic pregnancy because it will be closer to the cervix. And so the embryo does manage to implant, it will implant itself in the cervix. If it's placed too high or presses against the fundus, it can actually cause the uterus to contract, thereby expelling the embryo. Did you know that it is possible to have an ultrasound guided transfer that greatly improves the accuracy of the placement of the transferred embryo? So for your next cycle, simply ask your fertility specialist. Say something like this: "Hey doc, for the next cycle, I would like to have an ultrasound guided transfer." That's another thing that you might consider doing to increase the chance of your next IVF cycle being successful. Would you agree that the hands of a doctor who has done 500 embryo transfers is going to be a lot more skilled and possibly even more gentle than the hands of a doctor who's only done 20 embryo transfers? Obvious, isn't it? Yes, it is. But a lot of women do not know that it is possible for you to request to have your embryo transferred by the more skilled specialist. Often these fertility clinics have multiple doctors. So it's not just the doctor that you are dealing with that is working in that clinic. There may be a lot of different doctors. Granted, the fees of a doctor who's a lot more experienced, who has had a greater rate of IVF cycle successes, is going to be slightly more expensive than one who has less experience, but it's going to work out cheaper for you than having another failed IVF cycle. So another thing that you might consider doing for your next IVF cycle is requesting for your embryo transfer to be done by the hands of a fertility specialist who has a lot more experience with a greater IVF cycle success rate. A doctor who uses a gentle technique makes a big difference. Huge. Here's another tip. Did you know that some clinics also use muscle relaxants? Yes, they will use the muscle relaxants locally on your uterus, meaning that your uterus is less likely to contract during the embryo transfer. If the uterus does not contract during the embryo transfer, it is not going to expel the transferred embryo. If you don't ask, you will not get. So here's a concept that might be new for you. Did you know that mock transfers exists? This is basically a transfer trial, and we do this as a test before the real transfer actually happens. The purpose of these mock transfers is to make sure that we don't get any nasty surprises on the actual day when we're dealing with a precious embryo. So it will tell us if there's lots of trauma, lots of scarring along your cervix. It will tell us if it's difficult to pass the catheter through, or once the doctor is through your cervix into the uterine cavity, whether there's a surprise fibroid or a polyp, or it's difficult to advance the catheter. It will help us to know how smoothly the real transfer is likely to happen. So mock transfers, particularly for our ladies who have suffered multiple IVF cycle failures, I would strongly recommend and speak to your fertility specialist and getting one underway before your next cycle. So if you're a lady watching this and you've had multiple IVF cycle failures, here are some additional tests that I strongly recommend that you perform before going for your next IVF cycle. The first is a hysteroscopy or a saline sonogram. This helps to check if there are any polyps, adhesions, aka scarring, if there's any uterine structural abnormalities, all of which can get in the way of the implantation of the embryo. If you are suspected to have an autoimmune condition or blood clotting disorders, ideally you should have an immune panel and or thrombophilia testing. In a video I did about the rare causes of IVF cycle failures, I have described how autoimmune condition and blood clotting disorder conditions can interfere with IVF cycle, or should I say embryo implantation, leading to IVF cycle failures. So if you want to know more and in details, make sure you go ahead and watch that video after you finish watching this one. And finally, an additional test I would recommend that you do is karyotyping. This checks for rare genetic issues in either partners. So it doesn't just test for the genetic abnormalities within the egg or within the sperm. It actually screens the individual for any genetic abnormalities that they may have that will inevitably affect the gametes, and that means the eggs or the sperms that individual produces. Now, do not go and ask your fertility specialist to do all of these tests for you. That is not going to be necessary, just simply because not all of these tests are going to be relevant for you. Sit down once again and discuss with your fertility specialist. And with the information and the knowledge that you have now, speak to your fertility specialist and ask which of these tests are going to be more relevant for you. Did you know that it is completely reasonable for you to ask your fertility specialist, could it be that the protocol might need to be tweaked for you? Yes, there's nothing wrong in asking for the protocol to be adjusted for your situation. Some of the adjustments that your fertility specialist might consider are as follows. Number one, so by using different doses, we might be able to stimulate your ovaries to produce even more eggs and have a bigger pool of eggs retrieved. So we have a higher chance of having eggs that are of good quality in the bigger pool of eggs. Could we consider changing the embryo transfer technique? Could you benefit from some immune support? So for example, having some steroids to suppress your immune system and preventing your immune system from attacking the implanting embryo. Could it be that you might benefit from some blood thinners, particularly if it's been identified that you have a genetic condition that causes multiple blood clots that affect the endometrial lining? And finally, after some consideration, you and your husband may need to sit down and discuss that sometimes the pathway to parenthood might be different, and that for you as a couple, it may have shifted. And that's okay, but only you and your partner can decide that. Thankfully, in the 21st century, there are plenty of options. As mentioned before, donor eggs and donor sperm cells, surrogacy, adoption, or even consider taking a break for a while before you decide to go again. And that break might be a couple of years, or just simply surrendering all of your desires over to the Lord, trusting Him, and you desire the things that are on His mind, and you cast your cares upon Him, for He cares for you. You will see Him give you the desires of your heart, and oftentimes miraculously. Being the respecter of no person, God can do miracles. Yes, even in this generation, in the 21st century, He is the same yesterday, today, and evermore. He can take your breath away and cause you to conceive in the most unexpected way. Sometimes failed IVF cycles could be an opportunity for the Lord to show you His faithfulness and to come into your life in that trying time, in those difficult situations, telling you, trust me, rest on me, rest from your cares, rest from your troubles, rest from your agitation. A lot of people have testified that it is when they have decided to trust the Lord and leave all things to Him that they conceived. Could it be that the Lord is telling you to trust Him, rest on Him, pursue the desires of His priority for the earth, and then watch Him operate in your life? Use your life as a platform to display His glory and His miraculous ability. That's it from me. Thank you so much for watching this video. If it's been helpful, make sure that you have subscribed, you have liked, and you have shared. We'll see you in our next video. And in the meantime, there is so much content for you to feast on right here on Hey Doc. And until then, we will see you later.